The Committee for Economic Development of Australia has just released their latest report looking into aged care, and they found that many aged care facilities are operating under capacity due to worker shortages, with some as low as 50% capacity. Cassandra Winzar is Chief Economist with CEDA and joins us now. Cassandra, thanks for coming on. Good morning.
Thanks for having me.
So tell us some of the numbers. What are the primary concerns that you hold?
So look, what we found is that due to workforce shortages, quite a large number of aged care beds are sitting empty across Australia. And that's a real problem because there's actually demand and waiting lists for these services. So when we look broadly across Australia, the number of aged care beds sitting empty is around 14%. And that's bad enough. That's a pretty significant number. But whereas particular challenges is in regional areas that are really struggling to attract the workforce they need. And aged care facilities are really struggling there. And in some cases, their occupancy is as low as 50%, despite there being waiting lists, there being demand, and in many cases, people sitting in hospital waiting to be discharged to an aged care facility.
Is there any insight into what salary changes, recently announced salary changes, when they'll start to have an impact? I'm just curious about the data and the historical period that it reflects.
Yeah, so look, we have seen a relatively significant increase in wages. So they had a 15% wage rise, which came through in July. But even with that wage rise, it's still a very lowly paid industry. And it is more lowly paid than some of the kind of adjacent industries that people with similar skills would work in, such as disability care or healthcare. So what we're hearing is that wage rise has definitely helped a bit. It's keeping some people in the sector, so turnover rates or people leaving have reduced, but it's not enough to attract new people to the sector, particularly when we've got really low unemployment rates and a lot of demand for these skills across all sorts of industries.
So what happens in these smaller facilities? They'll simply just pull a door closed on a ward with 4 vacant beds in it. Is that what you're seeing?
Yeah, so they're not able to offer those beds up to patients, so they're closed off, and that's despite them having waiting lists. So they might be operating at 50% capacity, maybe a bit more, but we've heard that they are as low as 50%.
Yep.
And so that means only part of the facility is actually operating, and that's a real challenge for people that need care, and it's actually really hard for the ongoing sustainability of the home as well. And we have seen numerous reports coming out recently about facilities, particularly smaller regional facilities, that are having to close because they just can't get the workforce and they're not sustainable anymore.
Cassandra, is it workers, from everything to the front office to the kitchen, or are we talking specifically about nursing staff and nursing aides?
So it's mainly personal care workers. That's because that's the biggest chunk of the workforce. There are also issues around getting registered nurses. So each facility now requires a 24/7 having a registered nurse on staff, and that's been a real challenge. But it is also difficult to get all the other staff that kitchen hands, chefs, administration staff as well. But the shortages that are really causing the facilities to not be able to open up their beds are the personal care workers and the nurses.
Your report is pointing to a massive shortage of labour by 2030, which is not too far away, of course. You're looking at over 100,000 vacancies in direct care workers by 2030. Is there enough to suggest that we've got the mechanisms to fill that void, or is it likely that the condition or the situation will continue to deteriorate?
If we don't take some action pretty soon, I think those numbers are actually going to end up looking pretty conservative, and it's going to be worse than that. So there are no signs, despite the fact we had the Royal Commission just 2.5 years ago, and lots of talk about how we were going to improve the quality of care. There's no signs that we're increasing the workforce anywhere near enough to meet the requirements to provide that quality care. So if we don't take some action soon, the situation is actually going to deteriorate further than it already is at the moment, and it's pretty bad right now.
Do we know what happens to these people that are on waiting lists to get into these facilities?
So look, they might be at home, they might be cared for by a family member, or be receiving some home care, but not at the kind of quality or quantity that they require. But what also is happening a lot is that they're sitting in hospitals. So people are going into hospital, and the hospital has said that they're not well enough to go home because they need aged care, but there's no aged care places for them. This is really a poor outcome for the person. It's not nice to be in hospital if you don't need to be there. It's not a particularly pleasant environment, and it's also incredibly expensive to keep people who don't need to be in hospital in hospital. But hospital becomes essentially the care of last resort if there's no aged care facility for someone to go to, which is a bad outcome all around.
Ceilings on the amounts that users pay, is that a problem? There's been a discussion about user pays, particularly with those clients who can meet certain income or asset thresholds. Is that something that you've looked at?
Yeah, so look, that is something that really needs to be considered because part of the challenge here is that aged care providers are not financially sustainable. So over half of aged care providers are losing money. So there needs to be more funding so we can do things such as attract the higher quality workforce that we need. That will require some increase in government funding, but it's also going to require an increase in personal contributions from those that can afford it. So there's a reasonable a chunk of Australians that are not going to be able to afford to pay for their care, and that's fine. We should always have a really strong safety net for those. But for those that can afford to contribute a bit more, they should really be contributing to the cost of their care, particularly for the kind of lifestyle expenses, so food, activities, laundry, the sort of things that we all expect to pay for in our day-to-day lives anyway.
Because it is feasible, isn't it, in contemporary society that someone could go into an aged care facility, leave behind $1 million home and have, 6 or 7 digit amounts within their superannuation policy. And it does raise serious questions about whether or not the community should support those with a cap price aged care system in that context.
Yeah, so we need to look at the means testing and what sort of levels are there. So there is means testing around aged care, but it's very generous. So most people don't end up paying much towards their aged care costs. And so we do need to look at that because when we look at the growing demand for aged care services as our population ages, without some of this increased funding, some of which will need to come from personal contributions, we're not going to have a sector that can provide the quality of care that I think we all expect. I think, I certainly for myself and my family members want really high quality aged care, and that needs to be paid for.
Good to catch up with you, Cassandra. Thanks so much.
Thanks for having me.
Cassandra Winzar is the Chief Economist with the Committee for Economic Development of Australia, commenting on aged care and the dearth of workers, particularly personal care workers within that workforce.